right, good evening, everybody. Welcome to the Coronavirus Update Show. My name is Omari Salisbury.
And I'm Nikki Barron.
Producer Nikki Barron. Man, what's up? I just saw you this morning on the Morning Update Show.
Yeah, I did. Yeah, that was we've been off the air for a couple of days, which is weird for us. Normally, we just 2 days max will be off the air, but it was nice to have that holiday.
Well, it's good to be back. I wish it was under different circumstances, but this is an important show with information for the community. Why don't you tell everybody what we have in store for today?
Yes, so today we are with Tigran, who is with King County Public Health, and they are going to be telling us about the way the data works, talking about trends, kind of the how the infection rates are going, and we're going to get a little bit into the vaccine.
All right, fantastic. Well, as usual, we start off the Coronavirus Update Show with the numbers.
Yeah, so today's numbers. So if you tuned into the Morning Update Show, you heard one number, and they usually update these about 4:30 p.m. So these are your most up-to-date numbers as of 4:30 p.m. Our confirmed cases since Friday rose 1,877, bringing us to a grand total of confirmed cases of 229,672. Hospitalizations rose by 180, bringing us to a grand total of 14,276. And we lost 11 more Washingtonians over the weekend. Up next, we have our hospital readiness number, which has not changed since this morning, and that is our goal is 80%, and we are currently sitting at 82%. And basically what that number means is how many ICU beds are full. And we want to keep that number under 80% so that we can have our hospital systems manageable. So it's not a good thing to see it at 82%, but we're definitely trending better than a lot of portions of the rest of the country, especially places like California.
Yeah, actually, I see a lot of reports that say that overall the state of Washington is in pretty good shape compared to a lot of other places in the country, and especially King County, considering the size of the population in the city of Seattle, that we're actually leading, or I guess lagging, however you want to look at it, as far as COVID.
Yeah, we're at almost 84% as far as our beds go here as hospital readiness goes. But so we're doing a little bit worse than the state as a whole. But something we've talked about before is we also have a bigger, more robust health system. So there's a lot of opportunity there for people to be sending their patients to us.
Right,
Yeah.
exactly.
There's actually a really interesting map that I can bring up here. Let me see if I can share my screen so I can show you guys my map. So when you just go to Google, they've done such a great job of keeping all this data here for you. But if we look here at this map of cases, you can actually see where we compare to the rest of the country and even the world. So you can see California has a lot of cases. Yeah. Over 500,000 cases compared to Washington, which was that 200, I think it was like
229,000.
Yeah, so they're, double what we have.
Well, they have a big population there in California too.
Yeah, they do, but you can see Texas here is starting to balloon. But yeah, it's pretty wild, the numbers and the cases that are happening, but this big balloon over California really makes you nervous. Our neighbors there to the south.
Wow. Yeah. And are you able to put that link into the comments?
It's actually you just type in COVID map into Google, and Google created this. So this is
okay.
Yeah. So it's just there if you put in COVID number into Google.
Okay. Fantastic. Yeah. Anything else on the numbers?
That's all I've got for on the numbers. We're going to learn a little bit more about the numbers from our next guest.
All right. We're going to take a short break, and we're back with Dr. Avoundjian. You're watching the Coronavirus Update Show. Welcome back to the Coronavirus Update Show. My name is Omari Salisbury, joined by producer Nikki Barron. At this time, we're going to add Dr. Tigran Avoundjian. How are you?
Good. How are you?
Fantastic. I know Nikki Barron has a bunch of questions for you, so I hope you're ready.
I'll do my best to answer them.
Well, before we jump in, why don't you tell our viewers and listeners who you are and what exactly you do for King County Health?
Sure. So my name is Tigran, and I'm an epidemiologist and the technical lead of the analytics team in King County's Department of Communicable Diseases. I do quite a bit of different things, but mostly analyzing and collecting and kind of summarizing our all of the data that we get related to coronavirus in King County. So that's working with all of the different data systems that we have, with laboratories, with the state, with with any kind of like source of data that we get to kind of produce the reports that you see on our website, and also to help guide our investigation teams, detect outbreaks before they become like a bigger problem. And I also do work on like equity and making sure our response is serving our communities.
Man, you do a lot.
So, as the person who deals with the data, what can you tell us in the numbers, especially the ones I just went over? What does that truly mean for King County?
Yeah, so we are kind of still in the midst of a surge in cases that's been going on for the last couple of months. Kind of some of the struggles that we're having with the data recently is getting data in a timely manner, and trying to interpret the kind of changing trends that we're seeing in the context of these delays. We're seeing case counts dropping in the recent weeks, but it's still not entirely clear if that's a true drop in cases or if we're just seeing reporting delays. If you look back to the beginning of December, we had two of our highest case counts on December 2nd and December 3rd. So it's pretty clear to us that there's some delays in reporting that we're not capturing completely. So it's hard to say if what we're seeing is a true decline or due to cases decreasing. And even in the context of these delays, we still saw 513 new cases reported today, which is way higher than any number that we had on a single day in March. So that kind of puts things in perspective.
Right, so are we seeing an impact on the infections from the holiday, from Thanksgiving, and then now, or maybe for Christmas and New Year's? What are you seeing there?
It's difficult to tease apart whether it's because of Thanksgiving or whether it's because of things staying open, or people just kind of being more out and about and like gathering indoors. There's a kind of variety of factors. We still don't fully know if it's because of the Thanksgiving holiday. We certainly saw less of a spike than we kind of anticipated. So thank you to everyone who stayed home during the holidays. And it'll be interesting to see in the next few weeks if we see kind of a bump in cases because of the winter holidays in the end of this month. So it's too early to tell if any sort of increases because of the holidays here, but it's something that we're keeping our eyes on.
So it looks like we have a community submitted question, and Patrick Lachelle asked, is there a difference in the rates between urban, suburban, and rural King County?
Yeah, it's a really great question. I think by geography, what we really are seeing is that most of our the highest rates of cases that we're seeing are in the southeastern part of the county, so in like the SeaTac, Tukwila, Kent, and Auburn area. We do see kind of high rates in the eastern part of the county, where it's a little more rural. However, we haven't looked specifically among case rates by urban, suburban, or rural settings. So I can't give you like a complete answer on that.
Right. What is the data telling you, though? I mean, when you talk about a lot of those cities that you just mentioned, when you talk about Tukwila, SeaTac, and Auburn, Kent, area. I mean, primarily more and more these days, you have more and more people of color moving there. I know from the Central District of Seattle, a lot of people that I grew up with now live in that part of the county. So what kind of difference in rates are you guys seeing by race or any, or do you keep that kind of statistic?
Yeah, we definitely do, and we have a race and ethnicity dashboard on our website. If you go to kingcounty.gov/COVID, you can find it in our dashboards. The COVID pandemic has definitely hit our BIPOC communities much harder than the white community in King County. We continue to see higher rates among Native Hawaiian and Pacific Islanders, among the Hispanic and Latinx community, among Black individuals, and American Indian and Alaska Native community as well. And the same is true for hospitalizations and deaths as well. One of the interesting things that we put out recently is a report on outbreaks and exposure settings for King County. And if you look at where people are getting COVID or suspected to be getting COVID, one of the interesting things that we're seeing is that in the BIPOC communities, there's a higher proportion of those communities are getting COVID as a result of being essential workers or in their workplace in a setting that's basically kind of outside of their control. We kind of have to go to work, and if our employers refuse to give us sick leave, or we don't have time off or things, it's very difficult to make arrangements to kind of cut yourself off from your source of income. In contrast, if we look at the white communities in Seattle, the number one source of exposure is social events and social gatherings. So that kind of disparity between, we have part of our community being exposed in the workplace and part of our community being exposed in kind of optional like social settings. And that kind of is indicative of the structural racism that's like in our everyday lives. And it's not just because of COVID, of course, but COVID has definitely kind of amplified those inequities that we see on a structural level.
Right, and also I think that in some of these BIPOC communities that you mentioned, you have a higher tendency of different generations living all under one roof, and
Absolutely.
then also a lot more people in a smaller space. You might have a 2-bedroom apartment with 4 or 5 people. Grandma might live there, might be a small kid there, and and a working adult.
Yeah, absolutely. I mean, you have one person who's working, and they get COVID while they're at work. They come home, and if you're living in a multi-generational household, all of a sudden you don't have just one case; you have 4 cases. So it all kind of cascades together, and it's really a reflection of the need for like the structural change in the way we kind of treat our communities and how we take care of each other.
Right. So my next question that I had here is kind of transitioning into talking about vaccines. So right now I know we're vaccinating healthcare workers, frontline workers, and people who live in elderly care facilities, as well as people who work in those facilities. When is that next phase going to start where the general public gets to have the vaccine, and who's a part of that phase?
So right now we're vaccinating healthcare workers and elderly individuals who live in long-term care facilities, as you said, and we're hoping to move on to the next phase of vaccinations in early 2021. We're still planning. There's still like planning going on to determine who's going to be prioritized for the next round. The State Department of Health and is working on making those decisions with other groups, including King County as well. Kind of the general plan, it's likely going to be essential workers in other settings, and the elderly and people with pre-existing conditions is kind of the next groups that we're hoping to target. And then hopefully later in 2021, we'll have enough vaccine to be able to vaccinate everyone.
So I recently heard that when it comes to even vaccinating healthcare workers, we're running into issues where people are being prioritized, or not being prioritized by risk. And it's more of a free for all of who can get signed up first. Is that true for King County as well? Is it the trend that you're seeing where people who maybe work in administration are getting vaccinated, while nurses and others are still waiting in line?
Yeah, there's the story about the algorithm, right, in Stanford that was miscategorizing people. So far, that hasn't been the case in King County. To my awareness, we're trying to reach as many essential healthcare workers as we can. The priority has been first responders and vulnerable seniors. I don't have exact numbers just yet on how the vaccination has been going, but yeah, it's something we're hoping to make sure that we are prioritizing the people who need it.
So you guys use an algorithm to decide who goes?
No, sorry. That was in reference to an algorithm that Stanford was using.
Stanford is using, but King County
yeah,
Health is not using an algorithm. Okay.
No, we're trying to be a little more human about how we're prioritizing things.
Right, and so would teachers maybe be considered in that next phase?
Yeah, definitely. So then, yeah, it's still, as I said, it's still being worked out who's going to be prioritized for the next round, but it's likely to include essential workers in other fields, not just in healthcare, which would also include teachers if they're giving in-person instruction at that time.
So with this, is there any sort of prioritization for the BIPOC community if they so choose to be a part of that first group? I know there was kind of this discussion happening where it was like, we don't want to roll this vaccine out to people of color first because we don't need to be putting them as the test subjects in this really new kind of thing, but also we need to be prioritizing them because they are more likely to be frontline workers, essential workers, people who can't stay home and we're having the worst outcomes. Is there any sort of consideration for that when it comes to the way King County is rolling out the vaccine?
Yeah, it's a great question. I think what we're trying to do for the BIPOC community in King County is to try to support our communities, especially our communities of color, by advocating that we prioritize healthcare workers for vaccination, including technicians, home care workers, custodial staff, and other essential workers. We're also trying to make sure that the vaccine is accessible to everyone by providing free vaccination clinics in areas that are familiar to BIPOC people in King County. In terms of the prioritization, I can't really comment on whether there have been discussions to kind of make priorities by race, mainly because I'm not aware of those conversations, so can't really comment on regarding that. Yeah.
What is King County Health doing around messaging around the vaccine? Because there's almost a daily conversation on the Morning Update show where there's a lot of black people. I can't speak for the BIPOC umbrella, but a lot of black people I know in our community, they're not taking the vaccine, and I'll just be honest with you. It's just hard to, I guess, use the word win, because it's COVID is killing black people in some cases twice the rate of other ethnicities. You have this real historic based fear around government and everything else. We just saw this black doctor in Indiana, a doctor who was just sitting there on Facebook before she died talking about racist treatment in the hospital. We deal with the empathy gap on the everyday, and then you get a vaccine and we got a community who doesn't trust, who's dying more and faster, but then you've got a vaccine that people don't trust. I mean, it's a mess. And no easy solution, but what is King County Health doing? I'm sure you guys obviously see this issue like we do, and probably way more in depth. What else are you guys doing to try to cut through that?
Yeah, it's a great example with Dr. Susan Moore in Indiana. It's kind of a tragic case. It's infuriating too, like the way she was treated in the hospital, and kind of indicative of like how we treat people of color in this country, and specifically Black people too. It's pretty horrible stuff. In terms of what we're trying to do in King County is, like you brought up a lot of valid points. There is a historical mistrust of the government about vaccinations and things like that, and something that still exists to this day. I'm a first generation immigrant to this country, and I grew up around other first generation Armenian immigrants, and that same mistrust of the government and all that stuff is in my community as well. And I've been kind of dealing with it, trying to listen to people, hear out their concerns, and try to provide my expertise where I can. In King County, I think what we're trying to do is listen to community members and make sure that they feel like their concerns are valid, and to try to hear them out. So we're holding community listening sessions related to vaccination, about both the flu vaccine and about the COVID vaccine as well. We're trying to pursue funding for BIPOC community organizations to advise on and co-create outreach materials, so that we can really be a voice in the community and partner with existing voices in the community. We're trying to establish trainings to work with the Washington State Department of Health to develop anti-racism training for staff at healthcare facilities that provide vaccinations, so that they're better informed about kind of the needs of the communities that they're serving. We're trying to partner with community navigators and the pandemic and racism community advisory group, which includes representation from many community organizations and community health boards. And we're also trying to establish a system of accountability. We have a working group to collaborate with BIPOC and disability communities on the COVID vaccine specifically. And the group includes representatives from the community who advise and help hold the team accountable. And we have an equity response officer whose role is to monitor all of this work. In recognition of the work that public health in King County needs to do to improve equity, we've also hired a new position to focus on coordinating the BIPOC communities on COVID vaccinations, and another to support disability inclusion work as well. So we're really trying to do our best and trying to do as much as we can to support the BIPOC community and kind of alleviate the mistrust and kind of historical issues that we've had around vaccinations and healthcare.
So do you guys collect data on estimates of how many people are actually willing to get the vaccine? Is there any data on what you think our vaccination rates will be? And do you have that broken down at all by race, gender, abilities?
Yeah, it's a really good question. Unfortunately, I don't think we have such a data source. As you can imagine, it'd be pretty hard to get too, because if we're trying to gauge whether people trust us, we might not get answers from people who don't trust us, which is the group that we'd want to focus on. So
that makes sense.
Yeah.
Yeah, that definitely makes sense. So you were saying that, kind of early next year is when you guys will start rolling out more to the general public. What's the goal for getting to saturation when it comes to vaccines for King County and Washington?
That's yeah. I mean, I don't know if there's necessarily a number that we're trying to shoot for just yet for establishing herd immunity. There's been several numbers thrown around, between 50% of the population to 95%. So we're trying to vaccinate as many people as we can to ensure there's enough coverage so that we can protect the people who for some reason or another can't get the vaccine. But I don't necessarily have a hard number that I can be like, this is the threshold that we're going for right now.
So we reach whatever herd immunity looks like in Washington State. How will that change what life looks like? Are we still going to wear masks? Do we still have to social distance? Will we still see parts of the economy shut down?
Yeah, so the vaccine is kind of our latest kind of tool that we have to fight the pandemic, and it's a huge breakthrough. And we kind of look at it as like the cavalry coming in, to kind of help us get over the final hurdle here. But the vaccine alone isn't going to end the pandemic right away. We still have to stick with the basics, wearing a mask around people you don't live with, even your friends and family, limiting your activities outside the home, and practicing social distancing and washing your hands. All of those things are still useful tools that we have in our toolkit to kind of fight the virus. So we have to.
Yeah, I think that as well. That also leads into that. Now, there's a whole nother different group of people. I'm not talking about the black folks that we just mentioned earlier that they, have their issues with the vaccine. There's a whole nother group of people who just feel like, hey, I take the vaccine, but my life doesn't change. Still got to wear a mask. I still have to social distance. I still have to do all these things. So does that present another communication or messaging challenge? For people who might just be like, well, I mean, how do I see things getting any better if I still have to do the same things I've been doing? And then also if transmission can still occur, I'm not sure on that. If guys figured out with this vaccine, if you can still make somebody else sick, it seems like, and I'm just a media person, so I'm just throwing it out there of things that seem challenging in the messaging, because these are things we already hear from people who are like, their life's not really going to change much outside of maybe they might not die, but their life's not going to change much because there's still the mask, there's still the social distance, there's still stay away from people.
Yeah, I mean, so the way the vaccine works is it gives your body a set of instructions to be able to kind of fight off the virus if you get exposed to it. So it does prevent exposure and infection, and it also prevents transmission from spreading, because if you're fighting off the virus, you're not likely to spread it to other people. But you could still have the virus on your clothes. You could still, it could still be in the air, and it can still be around us. So especially if you haven't been vaccinated, there's still kind of a need to wear masks and limit activities and practice social distancing. What our hope is with the vaccine is that as more and more people get vaccinated and more and more people have another tool in their toolkit to prevent the spread of the virus, what we'll start to see is less of a need to do all of these prevention methods, and we can kind of go back to loosening some of these restrictions and get back to some semblance of normal life. So what the vaccine kind of gives us is over time a tool to kind of reduce transmission, so that we can kind of get back to a place where we don't have to do all of these other additional things as well. But it's going to take some time, and we got to kind of be patient and see it all the way through. If we just kind of rush into it and say well, 10 people got vaccinated around me, I can just stop wearing a mask and stop social distancing and go out to the bars or do something, it's going to still be an uphill climb. So we got to kind of take it a step at a time.
So will you guys be reporting on the saturation numbers as far as it goes? When will we be able to see what percentage of Washingtonians are vaccinated?
Yeah, definitely. It's something that we're working with the state on to kind of develop some reports and make sure that we're sharing these data with you all. We're currently 2 weeks in to the vaccination, so we don't really have a report built just yet, but it is something that's kind of being worked on and developed, and we hope to share some numbers with you all soon. If you go to our website, again, kingcounty.gov/COVID, you can see the latest news regarding the vaccine there as well. and see all of our data updates.
Give me something good to report daily. Like I always have to talk about how many people got sick, how many people are in the hospital, how many people passed away. Like, give me one thing, man.
But we're trying. We'll do our best. Hopefully, there will be good news in 2021.
Well, that's all my questions. Omari, did you have any more?
No, I'm good. I mean, we got to stay. This is a good conversation, though. And so, Dr. Avoundjian, I hope that you're down to join us again. I mean, clearly, this isn't going away fast enough. So, I think this is a very informative conversation. So hopefully you'll come back on the Coronavirus Update Show.
Absolutely. From a personal perspective, I'm a huge fan of Converge Media, so I'm happy to be back anytime.
Thank you so much.
Fantastic. Thank you, Dr. Avoundjian. Have a wonderful evening.
Thanks, you too. Take care.
Bye-bye. Hey, he's up on it. Epidemiologist. You be booking everybody, Nikki Barron.
I know. I've got a little fairy in my pocket, and she runs out. Her name is Mary, and she gets me all the great guests that I could ever want or need.
It's like all the top COVID people, man. They're coming and talking to you.
Yeah, it's been really, it's actually been really great. I've learned so much about the people who are responding to this pandemic that I didn't even know were positions that we had. Because it's kind of nice to get to see our tax dollars in action in a way that is really helpful and informative, and definitely makes me feel better, even though I have to be the one to give the bad news all the time.
And I will say this about Seattle King County Public Health is that early on, so it's like, a lot more people know about Converge, and they know about our morning update show now in December. But early on, back in March, April, they were reaching out to us on the morning update show. Like we have actually interviews from back in April where they had people out there, they were interviewing, they were, sending us numbers and everything else. So they do a great job over there, and Mary and her team over there, and keeping the community informed. So just want our viewers to know, yes, Converge, we're out here, everybody sees it. No, they've been talking to us literally from day one.
They have, yeah. And we've got a really great guest for Wednesday. We're going to be speaking with Daphne Pye. She's a health services administrator for Public Health Seattle King County, and we're going to be talking about access to programs for people in need during the pandemic. So that includes things like health insurance, getting ORCA cards, getting food assistance, home heating assistance paying your bills, the rent moratorium. She is the person to talk to about the resources that King County Public Health has available if you need them.
All right, fantastic. And that is Wednesday at 6:15 right here. And we're back again tomorrow morning. The morning update show. I'm sure I'll see you there. You'll have some updated numbers for us. Hopefully the numbers are,
luckily you get a preview because they don't update them till the afternoon. So you already know going in tomorrow what that's going to look like. So now you can brace yourself for it.
I was about to say I'm braced for it. All right. Well, man, thank you to all of our viewers out there. Appreciate you guys tuning in. Thank you. Appreciate your support of Converge. And thank you to Dr. Avoundjian for great conversation. And we'll catch you tomorrow, 11 a.m. on the Morning Update Show. Until then, peace.